Non-Hodgkin's lymphoma is a cancer of the lymphatic system. It consists of your organs and your tissues that make and transport your white blood cells, which are the cells that fight infection. When diagnosed and treated early, non-Hodgkin's lymphoma is curable.
Academy Award-winning actress Jane Fonda makes an announcement on Instagram that she's been diagnosed with non-Hodgkin's lymphoma, saying, quote, "I have something personal I want to share. I've been diagnosed with non-Hodgkin's lymphoma and have started chemo treatments. This is a very treatable cancer," she added. 80% of people survive, so I feel very lucky. So the Academy Award winner, really just a legend, 9 to 5, that movie, revealing she has been in chemotherapy for 6 months. So what is this specific type of cancer? What is the long-term prognosis? With me now to discuss, Dr. Frita Fisher. Dr. Frita, good to see you. So Jane Fonda saying, look, this is not stopping me. I'm still an advocate for the environment, and saying I feel lucky because it's 80% curable. What do we know about this and what she may be going through?
Good morning, Susan. So non-Hodgkin's lymphoma is a cancer of the lymphatic system, which is it consists of your organs and your tissues that make and transport your white blood cells, which are the cells that fight infection. For patients who have non-Hodgkin's lymphoma, they will have symptoms like swollen lymph nodes in their neck, in their underarms, in their groin. They can have an enlarged spleen, enlarged liver, night sweats, high fevers, unintentional weight loss. With non-Hodgkin's lymphoma, most patients are older than 65, which, even though Jane Fonda looks incredibly young, she is 85 years old. And the good news is that when diagnosed and treated early, non-Hodgkin's lymphoma is curable. And so she actually does have a pretty good prognosis.
And what are the signs of this? Would this just be Jane Fonda seeing her physician and then testing her blood? How would someone know?
So there are different types of non-Hodgkin's lymphoma. Some are indolent or very slow growing, and so it would be difficult to pick those up. But in other cases, you can have outright swollen lymph nodes that are large and sticking out. The same way that your lymph nodes may swell if you get a cold, they may be swollen even if you're not sick and staying that way. Also in your abdomen, you may notice protrusions where your liver is, where your spleen is. You can also have issues with your bone marrow. You can have itching skin. You can have high fevers. You can have night sweats that leave you drenched, have the sheets drenched. And so there are various ways to present, but when you go to your doctor and you describe symptoms, then there are tests that they can do to pick up the non-Hodgkin's lymphoma.
There has been an outreach on social media. We wish her well as well. Dr. Frita Fisher, thank you.
My pleasure.